These severe depressed scars need to be managed in stages. The scar is partly due to significant subdermal fat loss, resulting in visible depressions. Stage 1 involves releasing and disrupting the fibrous tissue with a procedure called subcision. Subcision releases the fibrous tissue, which causes the tethering of the scar. This may need to be repeated 2 to 3 times depending on severity of the scars. Stage 2 is to lift or raise the scar, as well as stimulating collagen production with the help of a particular type of filler. Stage 3 is performed with resurfacing lasers. Typically, CO2 laser is used, but other resurfacing lasers may be used. Microneedling radiofrequency is also an alternative depending on skin type. In Stage 4, we use peels for final touch-up. This would also include topicals such as vitamin C and many other agents. Patients must understand there is no quick fix with complex cases, which would require a combination of modalities being staged over a period of time. Please like, subscribe, and comment.